beneficial in the workspace by the bedside, because you're not faffing about with papers, and you can just sort of input your data efficiently, and you don't have to worry about records, sort of paper records just being left about lying around and then they get lost. Whereas if you have it on technology, you know that it's inputted there and then.
Fantastic.
I feel that I still had the time to do my patients' observations and have a conversation with them, and I wasn't staring at the machine the whole time. I was able to talk to them, look away from the machine. It was really efficient, flowing.
And there's nothing worse than losing the piece of paper that you wrote everything on as well.
And there's no waiting to have to, do it paper-wise, go and upload. It was just...
It was a lot less time consuming.
Mm-hmm.
So I feel it could be something to look into. I did think it was great.
Mm-hmm.
It was nice having my hands to use rather than having a paper, a pen there, and where's my pen gone. It was nice just speaking what I was seeing rather than...
Yeah, like I could look at Sue and Carol, have a conversation, and then say my number and then go back to having the conversation. I could still look at them. I mean, maybe I have to quickly glance at the machine to say the data, but that's all a quick glance. I'm not constantly staring at it. Time.
Massively.
Yeah, massively. That, like, if that was a real case scenario, in the time it would have took, say if me and Jan had done them paper manually, in the time it would have took to do Carol and Peter the current way, we could actually, in hindsight, if you think about it, we could have got all four of them done. One of us could have got all four of them done in the time it maybe would have took us to do one each.
Mm.
It is more time efficient, but I think also patient safety, because you might have a dementia patient, and say if you're holding like a phone or some sort in front of them, they might think, oh, that member of staff is recording me, so I'm going to attack at them. It does happen in practice, doesn't it? Whereas if it's just on your head, you're just speaking to the patient as you normally would. I think it's a lot more.
Yeah, or if you've got a patient on a mental health ward and they've not got their phone for a certain reason, and they see something that looks like a phone, they want to take that because they want to use the phone. Whereas if you can put it to the side and just talk. That family app. So for me, having obviously a family member who's in and out of hospital quite frequently, quite a lot over the last year, if I'd have had something like that, say trying to ring up and annoy the ward staff and ringing up to check how he is, if I'd have been able to see that his observations have been done, maybe that idea of the note thing, saying, that little voice recording or that note that could be interpreted, so I could see a note from them on the app saying, it says, Peter says he's okay, could you bring this, don't worry, just a little note, that'd really reassure me to go, okay, so he's fine, I know he's alright, he's being his cheeky self, he's asked for that note, and that'd be really reassuring. I wouldn't be having to ring up, but I think that's really great. Sometimes it just doesn't stop. Sometimes patients can be on the phone for a while, or equally if you're the family member trying to ring up, I know I've spent hours on the phone by the time I've got through and asked how they are. I've sometimes spent a good hour of my time.
I can understand patients, family members want to call up and see how their family members are doing, but at the same time that could be a phone call where someone else from a different department's trying to admit a different patient onto the ward and they can't get through because the lines are logged up the family.
That idea, the notes on the family app is a really good idea. Like if you can log on and say, John's had his blood pressure done, John's had his temperature done, notes say that he's okay, you can visit him later, he's had his tea, nothing, he's telling you, John said don't worry about anything. You could see those notes and communicate with your family member that way. You wouldn't need to ring up at all, would you?
No.
Or equally, you could put the note on saying, when you get a chance, can you please call the ward? And then they're only calling if the staff ask them to because they need them to.
Yeah.
Like a 5-second phone call to say, look, if they ring up, is that really okay? Because you've asked for that, you've asked them to ring up, so you've set aside the time for that phone call because you clearly need to take it for a certain reason. So it's, you know, that 20 minutes you're on the phone is because you've asked them to ring up, not because they've rang up and you can't get them off the phone.
Yeah.
You know, they've rang for a reason and that's fine.
I feel a lot of the conflicts between family, public and nurses and stuff too is they'll ring up, they'll ask to know how their uncle's doing. Whoever's answered the phone will go, oh, I'll get the nurse who's looking after him. They'll go to the nurse go, I'm busy, I'm trying to do a cannula, I'm trying to do this.
Or I've had it before where I've been off for a week, I've gone in, and then I had it the other shift, I had 2 patients' families ring up, and they're like, well, can you tell me how such and such is? It's all actually, I had to be truthful, say, look, I've not, this is my, you know, I haven't been on the ward in a week, I've not had a chance to meet your family member yet. Unfortunately, there's no one about who's done enough shifts with your family member to give a decent enough handover.
As for the phone calls though, when you say, look, the nurse in charge will give you a call back after when she's dealt with the other patients and you forget, and they ring up again and go, oh, I was meant to have a phone call, but if we had that voice note in the voice recognition in the app.
Yeah, or I think it saves, we've had patients in the past who they've got family members and the sister might not get in with the mom and don't live with them, or they might not like the person's partner. So not only do you have the partner ring up, the mom might ring up and the sister might ring up because they all don't communicate. Whereas if they can all just download the app, you can put the notes on, there's no ringing up from 3 different family members. They've got the app to see how Joe Blogs is, they know he's alright. Especially especially where I work, if we could just literally put their own, I mean, we do have some patients who the family members ring up because they're not great with technology or their parents are older, and that's fine, that's understandable, but for patients whose families would be able to access and use the technology, the less phone calls, because that 5 minutes on the phone could be spent starting the med round, that's 5 minutes you're late to the med round or finishing it. Some nurses are very quick to go, it's fine, there's been no changes, end of. Some will give a detailed of how they've, it's very hit and miss as well. Very simple, clear cut, if family's okay, please don't worry,
So it's always going to be.
Up to date, isn't it? Yeah.
It depends. If you've got someone, say if you've got a bay, you've got 10 patients, and they're all okay. They're on 6 hourly ops. One person might drop. They might drop down to 2 hourly, but because you've been in such a routine of the 6 hourly ops, you might get busy helping someone to the toilet, or you know, you get distracted, and then you go, oh goodness, I was meant to do their ops 20 minutes ago, an hour ago. Sometimes it's longer, and then you go, oh well, something could have happened, like detrimental could have happened in that time. And I think with the voice noting thing, I think the alerts and the can you go to bed so and so, I think it's a great way of prompting you to say, look, you've got something to do, shimmy along sort of thing.
And maybe like, I know how they already have, maybe the hospitals like have computer screens and they're colour coded with like how long the patient's been waiting and stuff. If you have that like it shows in the book, like the tablet, and it says that, you know, John Smith's overdue, thing is on time, and you can see the colour coding to see if you'd have something like that maybe at the nurse's station or at the end of the ward. So when you walk on the ward, say if it was in front of that mirror, you've got the tablet there on the stand, you can just go up, log in, it'll tell you if anyone is checking or not, and then that's it. There's no question about if you've like missed someone.
See, the vital packs do that now, and I think almost the alarm, like even if the device in your pocket, not necessarily it says you need to do this, rather than a demand, maybe a buzz is like a little reminder, or you know, something to say you're meant to be doing something. I'm trying to tell you, but I think that'd be a great way. I can see it coming in the future, definitely.
As long as it's in the right ward environment, so it's like you said, like A&E itself maybe not necessarily so useful, but maybe a surgical ward, post-surgery, older adults, general wards, it would be really useful on. But there's some wards maybe obviously, but then you know that when you're implementing it properly, which wards it, because not every ward would be able to use it properly, not every hospital setting, but even if you can just get it in the right wards in the right places, that saves up, like you say. The more nurses you can save up their time, the better. Even if you can't implement it on every ward, if you even just one ward you can save like hours on.